All right, good afternoon. So today is going to be pretty brief, but since it is February and it is a heart health month, I did want to talk about menopause and how our hormones, or sometimes lack thereof, actually affect the opportunity or risk, I guess, the risk factor of us having a heart attack or a stroke. So as we are aging, obviously, our sex hormones tend to decrease, and we lose a lot of estrogen, or our estrogen level is probably the most that's affected as far as our sex hormones are concerned. There are also 3 different classifications of estrogen, and estrogen has over 400 functions in our body. A lot of those are actually metabolic functions as well. But as I said, we have over 400 functions, or estrogen has over 400 functions. And specifically, what happens after menopause is that the protection that we used to have due to the lack of estrogen, or the drop in estrogen, is no longer the same. It changes. And that's why our risks tend to increase for most women post-menopausal and beyond. So estrogen actually helps protect by preventing inflammation that contributes to the buildup of plaque in the arteries. So oftentimes that's what you'll hear is how the arteries get plaque or clogged, and that tends to increase as our estrogen levels drop. And the way that looks also changes, and that's why there's an increase of heart attack, stroke, et cetera, et cetera. So we tend to become more like men as we lose that estrogen, and men definitely have a higher risk of heart attack than premenopausal women. But as we lose that estrogen, the heart risks become higher. So what are the things that postmenopausal women should do to focus on their heart health? And that's really just to take a focus or take a look at the risk factors, like watching your blood pressure, watching your cholesterol levels, obviously maintaining a healthy weight, choosing heart healthy foods that I mentioned a couple weeks ago. And then, of course, exercising regularly and just watching your alcohol intake. And also, obviously, smoking is definitely something that you want to stop doing if you are doing that. So just to reiterate again, as our estrogen decreases with the onset of menopause, we are at an increased risk of heart attack or stroke or any kind of heart-related disease. And we want to also just be aware of the things that we can be doing to help ourselves and help our heart health. So getting your cardiovascular exercise for sure, getting out there walking, getting your heart rate up a little bit. Your heart is a muscle. You can train it to be stronger. Obviously, watching your salt intake, watching your fat intake, really trying to focus more on heart healthy fats like avocado and olive oil and olives, and coconut oil, and eating good healthy fishes that are, fatty, but a good fat. Making sure that you're taking your omegas, your fish oil supplements, And also you might want to look at taking turmeric. That's about it. Trying to eat less processed food. Just keep moving. So that's all I have on tonight's live. It's short and sweet. Just wanted to alert everybody if you don't know. And that's also why if you were on the live with the nurse practitioner who was talking about HRT, that's why you'll hear a lot of doctors and nurses and talk about doing the HRT or using that as an option for your heart health. Haven't gotten to that part of the hormones course yet in menopause, but I do know that estrogen plays a huge fact in your heart health, and that you can get some estrogen replacement therapy, hormone replacement therapy in the form of estrogen if you are suited for that. So just something to look into for those of us that have entered the menopause phase. Have a great evening. If you have any questions, as always, just pop them in the comments below. Let me know if you are out here watching this live or on the replay, and I will see you next week.